Are you or a loved one living with epilepsy? Managing this condition can be challenging, but there are medications available that can help control seizures and improve quality of life. One such medication is zonisamide. In this video, we will take a closer look at zonisamide, its benefits, and potential side effects in epilepsy management. What is zonisamide? Zonisamide is an antiepileptic drug that is commonly used in the treatment of epilepsy. It belongs to a class of medications known as anticonvulsants, which work by reducing abnormal electrical activity in the brain, thereby preventing seizures. Zonisamide is available in tablet or capsule form and is usually taken orally. How does zonisamide work in epilepsy management? Zonisamide works by stabilizing the electrical activity in the brain, making it less likely for seizures to occur. It enhances the inhibitory neurotransmitter GABA and blocks sodium and calcium channels, which are involved in the generation and spread of epileptic activity. The exact mechanism of action of zonisamide is not fully understood, but studies suggest that it may also have a neuroprotective effect, protecting brain cells from damage during seizures. This makes zonisamide a valuable tool in managing epilepsy, as it not only helps control seizures but may also help prevent long-term neurological damage. Benefits of using zonisamide for epilepsy management. Zonisamide has been proven effective in reducing the frequency and severity of seizures in many patients. It can be used as a monotherapy, meaning it is the sole medication used to manage epilepsy, or as an adjunct therapy, meaning it is used in combination with other antiepileptic drugs. One of the key benefits of zonisamide is its long duration of action. It has a half-life of approximately 63 hours, which means that it can be taken once or twice daily, depending on the individual's needs. This convenience makes zonisamide a popular choice for individuals who prefer fewer daily doses or have difficulty adhering to complex medication regimens. Another advantage of zonisamide is its broad spectrum of antiepileptic activity. It has been shown to be effective in various types of seizures, including partial onset seizures, generalized tonic-clonic seizures, and absence seizures. This versatility makes zonisamide a suitable option for individuals with different types of epilepsy. Potential side effects of zonisamide. Like any medication, zonisamide carries the risk of certain side effects. These can range from mild and manageable to more serious. It is important to discuss these potential side effects with your healthcare provider and weigh them against the potential benefits of zonisamide. Common side effects of zonisamide include dizziness, drowsiness, and loss of appetite. These side effects are usually mild and tend to improve over time as the body adjusts to the medication. However, if these side effects become severe or persistent, it is important to consult your healthcare provider. In rare cases, zonisamide can cause more serious side effects, such as an allergic reaction, skin rash, or mood changes. If you experience any unusual symptoms while taking zonisamide, it is important to seek medical attention immediately. Your healthcare provider will be able to assess your symptoms and determine the best course of action. Dosage and administration of zonisamide. The dosage of zonisamide will depend on various factors, including the individual's age, weight, and the type of seizures being treated. It is important to follow your healthcare provider's instructions regarding the dosage and administration of zonisamide. Zonisamide is usually started at a low dose and gradually increased over time until the optimal dose is reached. This helps minimize the risk of side effects while ensuring maximum effectiveness. It is important not to exceed the recommended dosage without consulting your healthcare provider. Zonisamide is typically taken orally, with or without food. It is important to take the medication at the same time each day to maintain a consistent level in the body. If you miss a dose, it is important to take it as soon as you remember. However, if it is close to the time for your next dose, it is best to skip the missed dose and resume your regular dosing schedule. Precautions and contraindications for using zonisamide. While zonisamide can be an effective medication for epilepsy management, there are certain precautions and contraindications to consider. Zonisamide should not be used by individuals with a known hypersensitivity to the drug or its components. It should also be used with caution in individuals with a history of kidney or liver problems. Zonisamide can interact with other medications, so it is important to inform your healthcare provider about all the medications you are taking, including over-the-counter drugs, supplements, and herbal remedies. Certain medications, such as carbonic anhydrase inhibitors or valproic acid, may increase the risk of side effects when taken with zonisamide. Zonisamide interactions with other medications. Zonisamide can interact with a variety of medications, so it is important to inform your healthcare provider about all the medications you are taking. Some medications may increase the levels of zonisamide in the body, leading to an increased risk of side effects. These include carbonic anhydrase inhibitors, valproic acid, and certain antidepressants. On the other hand, certain medications may decrease the levels of zonisamide in the body, reducing its effectiveness. These include enzyme-inducing antiepileptic drugs, such as carbamazepine, phenytoin, and phenobarbital. Your healthcare provider will be able to assess the potential interactions and adjust your medication regimen accordingly. Patient experiences and testimonials with zonisamide. It can be helpful to hear about the experiences of others who have used zonisamide for epilepsy management. While everyone's experience may be different, patient testimonials can provide insights into the potential benefits and side effects of the medication. Many individuals have reported positive experiences with zonisamide, noting a reduction in seizure frequency and improved quality of life. Some have also mentioned the convenience of once-daily dosing and the ease of incorporating zonisamide into their daily routine. However, it is important to remember that individual responses to medication can vary, and what works for one person may not work for another. Alternative treatment options for epilepsy management. While zonisamide can be an effective medication for epilepsy management, it is not the only option available. There are several other antiepileptic drugs that can be used, depending on the individual's needs and preferences. Your healthcare provider will be able to assess your specific situation and recommend the most appropriate treatment option for you. In addition to medication, there are also non-pharmacological approaches to managing epilepsy. These include lifestyle modifications, such as getting enough sleep, managing stress, and avoiding triggers that may provoke seizures. Certain therapies, such as ketogenic diet and vagus nerve stimulation, may also be considered in certain cases. Conclusion: is zonisamide the right choice for you? Zonisamide is an antiepileptic medication that can be an effective tool in managing epilepsy. By understanding its benefits and potential side effects, individuals can make informed decisions about their treatment options. It is important to work closely with your healthcare provider to determine if zonisamide is the right choice for you, taking into consideration your specific needs, medical history, and any potential drug interactions. While zonisamide has been proven effective in many cases, it is important to remember that individual responses to medication can vary. What works for one person may not work for another. It may take some time to find the right medication and dosage that works best for you. Always consult with your healthcare provider for personalized advice and guidance. Managing epilepsy can be a lifelong journey, but with the right treatment plan and support, individuals can lead fulfilling lives. Whether you choose zonisamide or another medication, it is important to stay informed, seek regular medical follow-ups, and take an active role in managing your condition. Remember, you are not alone, and there are resources available to help you navigate your epilepsy journey.